Oh yeah, when did it start?
Alright. Oh, there's more. Okay. How do I know what I answer?
There should be like a checklist thing over there that I'm supposed to ask you.
Oh, that's for me. That's what's up. When did it start? Oh, about 40 minutes ago.
Okay, have you ever had an episode like this before? Just making up.
Yes, but not exactly the same.
Okay, well what's the pain like?
It's 7 out of 10. It's in the middle of my chest. And it feels like a pressure.
Where's it located?
In the middle of my chest.
And does it radiate anywhere?
Yeah.
Where?
It's my neck and then my left arm.
Okay. And it's just been going on for 40 minutes?
Yeah.
Has anything made it better or worse?
Oh.
No. Okay. Alright. Well, I'm sorry that you're feeling bad.
Then why are you smiling?
I'm happy for well, have you had any other symptoms?
Oh. So what was that? I was breathing.
Gosh, just listen.
No, I haven't had any more symptoms.
Have you had any episodes of sweating?
Yes.
Any nausea or vomiting?
Not that I can recall.
Any pain anywhere else, like your stomach or your head?
I mean, it's just a little nausea, I guess. Like my stomach hurts a little bit. I haven't vomited or anything.
Vomited. Are you wheezing? Are you having any difficulty breathing?
I feel like I have to breathe. I'm having difficulty breathing.
Okay. What is it made worse when you take in a deep breath or when you breathe out?
No.
Alright.
All I remember was waking up at 5 this morning, and this pain's there. And then when I walk upstairs,
Okay, so exertion makes it worse.
what's exertion?
You're retarded.
Just because I'm vomiting, then you get to call me a retard.
Okay. Well, and you haven't noticed anything else strange recently?
I just now started sweating.
Oh, okay.
Yeah,
It's hot in here.
it is. Ooh, so take off all your clothes. Ooh.
Okay, well, I need to ask you a little bit of history on your previous medical illnesses. I'll even notice right now. So, what have you been hospitalized for in the past?
Well, I got the high pressure.
Oh, okay.
I got the high blood,
High blood pressure.
and I'm taking the water pill,
Okay.
and my cholesterol is high.
Mm-hmm.
So, but I manage that with my diet. I don't go to Popeyes as much, but I still can go. The doctor said.
Okay. Anything else like diabetes?
Well, I got me this GERD thing. You know, we got the acid reflux. Got some of that.
Have you been having any problems with that recently?
I mean, it's been upsetting me a little bit, about 2 or 3 times a week.
Okay.
If I take an antacid, so.
What other medical issues do you have?
That's about it right there.
Any previous surgeries?
No,
Okay.
none that I can tell, but I am slightly rotund.
Okay. Well, I'm sorry about that.
Well, that explains the hypertension.
Now, what other medications do you take? You said you take an antacid for your GERD. And you take a water pill for your hypertension.
I take me a water pill, and I also take me the Maalox.
Okay.
Take me the Maalox, and that's it.
Okay. What about any allergies to any medicines or foods?
I just read one of these things. This is funny. No, I got me none of them.
Okay. What about your family history? Do any illnesses run in your family?
My father died of lung cancer. Man loved his Bronco cigarettes. They're on sale and cheap.
Who doesn't?
Well, that's what I'm talking about. Ow! My mama, she alive. She got herself some peptic ulcers. But no heart attacks or nothing.
Okay. And then what do you do for a living?
I'm an accountant.
Good. Do you smoke cigarettes at all?
Cigarettes, define smoking. I'm just kidding. Whew, I stopped smoking about 3 months ago.
Oh yeah, how long did you smoke?
I've been smoking for about 25 years.
Okay. How many packs a day?
I was a 1 pack a day myself.
Okay.
Daddy raised no fool. 4 packs will get you in the grave.
Do you drink alcohol?
Every once in a while.
How much?
I'd say about 1 or 2 beer on the weekend.
Okay. Any other illicit drug use or IV drugs ever?
I mean, I use some cocaine once a week. That's the one that got me. Cocaine once a week.
Well, that's for real. You're not making that up.
That was for real.
Okay. And are you sexually active currently?
Well, doctor, to be honest, I haven't had sex with my wife for the last 3 months because I get this pain in my chest during sex.
Huh.
Yeah.
What did your wife say about that?
She told me to get some more exercise, but I don't exercise. So I thought that was my exercise day. That's what Arnold Schwarzenegger said in his video, get pumped, get buck. So...
Do you use condoms?
Well, she had herself a hysterectomy,
Huh?
so I don't have to use them. I mean, she's a street hooker, but you can't get her pregnant that
Are
way.
you sexually active with anyone besides your wife?
Well, I mean, I just lay there. Huh? No, I'm pretty monogamous.
Oh, good. Monogamy is wonderful thing. Alright, well let me summarize. You've been having about 40 minutes of chest pain that's located in the middle of your chest that radiates to your neck at 7 out of 10 in severity, and you haven't had any other symptoms besides some sweating and maybe a little bit of difficulty breathing and some pain whenever you exercise.
And then don't forget the nausea.
Oh, and you've had a little bit of nausea,
But no vomiting.
but no vomiting.
No vomiting.
Okay, well that's great. Well, I'm going to need to do a physical exam, if that's okay with you.
Well, Doc, I'm sexually active and I hadn't had me a pap smear in a while.
Well, we
So-
can take care of that a little bit later.
Okay.
I'll just have to do a breast exam. Okay, let me wash my hands.
Alright.
They're clean. I probably put on some gloves too. You might have HIV. Okay, can I untie your gown? I need to listen to your heart. Okay, we're gonna make this untie. Okay, now I'm gonna listen to your heart. Okay, that sounds normal. I'm gonna listen to your lungs. Also, normal. Okay. Now I'm going to need you to lean back, and I'm just going to pull this straight down.
Woo, son, I charge for this.
Because I need to take a look at your abdomen.
Yeah, that's a 6-pack right there.
Listen. Okay, are you having any pain anywhere?
Mm-mm. 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 I'm good, it's all good.
Are you really having pain?
I'm just a little gassy.
Oh, okay. Okay, well, I'm gonna cover you back up, and we can sit up, and I'm gonna also take a listen to your carotids.
My what? My what now?
Your arteries that go to your brain. Your brain.
Ah! The train. Nah, I drove. I'm gonna be a good SP, by the way.
Alright. Well, based on your physical exam and what you told me, you might be having a heart attack.
Doc, does this mean I'm gonna die?
Well, we have some really great treatments in case that you are having a heart attack, but we want to run some more tests to make sure whether you, I don't even know.
What kind of test?
We're probably gonna take some blood and check the proteins to see if there's any damage to your heart. We're also gonna put a little monitor on you to check your heart to see if there's any problems with, how it's beating or anything like that. Okay. Do you have any questions about anything?
No, that sounds about good.
Okay,
Sounds
no,
about good.
no concerns.
I mean, that is a heart attack. I'm gonna die.
Well, I hope not. I
That'd be-
won't get paid.
To be a great loss for society, sir. Ooh.
Okay, well, is there anything else that you can think of that you need to tell me?
Well, remember I told you I was on a strict diet
Nope.
for my cholesterol? Well, I cheat every once in a while.
Oh, yeah.
Man, I don't give me no exercise or nothing.
Surprise. Well, sorry, I should have said that.
Wow. I have never.
Okay, well, I think that it is important that, number one, we focus on your possible heart problem and rule that out and take care of it if it is a problem. But also, once we get you past this, we need to make sure that we work on your exercise and your diet.
That's probably pretty good.
Okay?
That's pretty good.
Okay, well, I'm going to leave now.
Alright, sounds pretty good.
Try not to die.
I won't go down on you, Doc.
Thank you.
I mean, don't worry about it. America paying for me with that disability and Medicaid.
Peace out.